Simone here, coming to you for yet another Facebook Live. And this time we are discussing the vaccine. You know, so many of us have so many questions, and we seem to be getting our information from just about every source in the world. So I thought this would be a great time to have our medical experts join us, have two of our doctors join us to give us the information that we need about the vaccine, to answer our questions, and to just engage in a conversation about the vaccine in general. So how is everyone doing? Let's give everyone a few minutes to come on in, come on in. Of course, we appreciate everyone who's been sharing the lives, sharing the information, and getting the information out to everyone. So while we are coming in, I know everyone is certainly happy to see the end of 2020. Is there anyone who is not happy about 2020 coming to an end? I don't see any hands. But I know we're looking forward to 2021 for sure, the promise, the hope of a new year. So I know that we're looking forward to 2021. So I just want to make sure that we're going into the new year with the information that we need to help us in terms of our health, and just help us out in general. So come on in. We have two doctors with us today. We have Dr. Swinburne Augustine, who is an award-winning immunologist, and he'll introduce himself in a little while. And then we also have Dr. Wilhelmine Adrian, who is a public health expert, and she'll introduce herself in a little while as well. So come on in, join the conversation. We're looking forward to hearing from you and to being able to answer your questions today. So we will give everyone a couple of minutes to come on in to share the live so that we can get started on this very important conversation. And of course, while we are waiting for everyone to come in, we just want to thank everyone who's shown a tremendous amount of support for the work that we're doing, everyone who always shares the live to get the information out. And especially we want to thank our experts and our guests who always make themselves available to be on these programs with us, because as you know, they are all very busy professionals, but they make the time to come on and share with us. So I want to thank them. And of course, we have to thank the healthcare workers who have been working tirelessly during this COVID-19 crisis to help us, to support us, and to ensure that we maintain our health. So we certainly have to thank them as well. So let's go ahead and get started, and we will begin with our introduction. So let's start with Dr. Augustine Swinburne. Augustine, tell us who you are, where you're joining us from, and what is your profession?
Hi everyone, happy holidays, and I wish everyone a happy new year, a happy and safe new year. I'm from Dalis in Dominica, and I'm a scientist here working for the federal government. And let me just say right from the very beginning that anything I say on here today is factual, but I'm not here representing the federal government or the agency that I work for. So I'm doing this in my own capacity to try to give you the information you need to make wise decisions about the COVID-19 vaccine. All right.
Yes, and then we have Dr. Wilhelmine Adrian. Introduce yourself as well.
Hi, I am Wilhelmine Adrian. I'm from the village of Point Michel. Yes, I have my doctorate in public health. I'm also a registered nurse, currently practicing in palliative care and hospice care. I'm happy to be here again to share what I have with your audience and hopefully to help them make a decision in terms of receiving the vaccine. And pretty much that's what I have to say. Thanks for having me, and happy Merry Christmas to everybody.
Yes, yes, and thank you for being here. Thank you for being here. So we see Carol is already with us. We have Kelvin, Francis, Gloria. So thank you everyone as you come on in. So again, my name is Simone. This is Push Past 10, and we are talking about the vaccine. There's so much misinformation circulating around that we thought today we would bring on two doctors from Dominica to enlighten us about what we need to know about the vaccine. And keep in mind, we are not here to try to persuade, to try to convince anyone as to whether they should take the vaccine or not. What we're doing is providing the information, and what we hope to do is give you enough information so that you can make your own personal choice in terms of the vaccine. So let's just dive right into the conversation. We're just going to have a conversation, and of course, if you have any questions as we go along, you can feel free to post your questions and we will try to get to them as soon as possible. So again, we see Medina Senhouse, my mom. I have to tell you guys, I have the most supportive family in the world. They're always logged onto my Facebook Live, so thank you, Mom, for being here. Shari Bryant and Agnes Etienne is also joining us. So again, welcome. So now let's just get into the conversation. Let's talk about the actual vaccine and how it was created. So for either one of you, if you want to jump in and tell us a little bit more about the vaccines.
All right, I can start. So I will start with a question that I ask myself. Would I take that vaccine, and why? Would I give it to my family? My answer is unequivocally yes. I would, as a matter of fact, my daughter, who is an emergency room physician right here in Ohio with me, just took her shot, the first of the Moderna vaccines, on last Thursday, right before Christmas. And it's funny, I asked her how she's feeling. She said, in one word, normal. The reason I say that is because I know there's a lot of misconceptions. There are lots of doubt on whether, especially with the African community, the African American community, because of things that have happened before. The Tuskegee experiments and all these other experiments, unethical experiments they've conducted. But this is not the way it is today. I do experiments on any time. Most of my research is human subjects research. And before we can do that, anyone trying to do human subjects research, after all those things came to light, they instituted a set of policies, the Belmont Report and the Nuremberg Report. We have to be trained to do no harm. And the key is that whatever research we're doing have to benefit those the people that we're conducting the research on, and we can as much as possible do no harm to them. So the creation of the vaccine, a lot of people are like, well, it usually takes years and years to have a vaccine. Well, that is true, but we're in a different situation with the pandemic. The entire world, the entire scientific community is focused on that virus and on stopping and controlling the spread of the virus and the horrible death toll that it's having on us. So later on, I will try to explain exactly what the old vaccines look like and what the new ones look like. But I have total confidence in the science, the results, and I honestly believe that is one of the ways, among social distancing and masks, that is one of the key ways that we will get out of this mess that we're in with this virus.
Yes, and I'm very happy that you brought that up, Dr. Augustine, because when we think about it, just in the month of December, over 70,000 Americans have perished. Let me say that again. in the month of December only, over 70,000 Americans have perished from this disease. So it really says to us that yes, the mask wearing and the social distancing and everything else that we're doing is important, but more needs to be done. More needs to be done, because we simply cannot continue like this. And just to put it in perspective, if you're from Dominica, that means the entire population of Dominica has died in 1 month. So it really tells us that there is more that we need to be doing to get this situation out of control. And I think for some reason, and Dr. Adrian, you can jump in on this one, I think for some reason, the shock and the awe has gone away, and people are just going about their lives as normal and almost kind of not thinking that this is important anymore. What are your thoughts about that, Dr. Adrian, as a public health expert?
Simone, I think people have let down their guards for whatever reason. And not only that, I think it's just because of publicity. Because I remember sometime in, I want to say November, I'm in Houston, Texas, and our rate was like about 23%, 25% almost, about there. And it had gone down to 5% of positivity rate. I just before coming in, I had an alert that they're asking people to stay in within their home bonds or to stay within their family to enjoy or to celebrate New Year's and not go out to groups that you're not accustomed to being around, only because in the past week or 2 weeks, we have had triple the increased rate of positive rate. So we had gone down to less than 5, and now we're up back to 11 from 23 thereabout. So yes, people have let down the guard. I think people are just tired of being, how would I put it, focused on what they have to do or what they need to do, I should say. Yes, we want to go out and we're tired of staying in. But then again, even washing hands, the basic things like washing hands, social distancing, wearing your mask. Although it is, I see it quite a bit in Houston, but in terms of washing hands when you go home or washing hands when you're coming out, I'm not sure how often people do that. I'm not seeing the hand washing as often, but I definitely see an increased number of people wearing their mask. Again, I think people are just tired and just letting down the guards.
Yeah, and I think especially now that we hear there's a new variant, a new strain that is even more contagious, it just feels like there's not an end in sight to what is going on. So I think people have resolved themselves to just living their lives and just letting what will be, and that is certainly unfortunate. Now, Dr. Augustine, back to you. So I think one of the concerns is that the terminology that was used in the beginning, the whole thought of the warp speed, I think that kind of caught us off guard. And I think a lot of people got stuck on that and just thought to themselves, well, if it was created that quickly, how can it be effective? How can it be safe? And I remember, because you were on my radio show, Untapped Potential, and you gave us a wonderful explanation to counteract that. And I want you to explain that again to our audience.
Okay, so it is a really fast process they've used, but the technology and the platform has changed, right? But what people need to understand is that we didn't just start working on that vaccine now. We've been working on coronaviruses with the MERS and the SARS, the chicken flu, and all those, the MERS in the Middle East. We've been working on, people have been working on those vaccines for years. So this virus is one of those coronaviruses. It is one of those. So they knew, they were working and using that platform before. So now that we needed those vaccines, it was easy to use the research that was done before. And that is something people have to understand about research. Research is this. Einstein once said, We call it research because we don't know what we're doing. If we knew what we were doing, we wouldn't call it research. Search again, right? So they've been working on those things, and now the entire global community, the entire global scientific community, all the governments of the world, with all their resources are focused on one thing. So you were talking about what I brought up last time, is that if someone, you had all the architects, the builders, with all the equipment and all the funding to build your house, it will not take them very long to build that house. You know, if just a few contractors are building your house, they have to be, we see those shows on TV, right? Where they're renovating houses, and then every time you have to add more money and add more money. But if you have all the resources, just like all the scientific community, everybody's focused on just this thing with everything they need, then it will take a lot less time. And the way they're doing it now, it's using the knowledge we know from how bacteria and viruses invade our cells and manipulate our cells to propagate themselves. So we know how to block them, right? We already knew that. So now that's why it's so much easier. I hope that explains it.
Yes, so that is very helpful. And again, we just want to thank everyone who's joining us on the live right now. I see Joseph Hyacinth, Shari is here with us, Sugars Joseph, Patricia Lugue is here with us. And again, we just want to encourage everyone to ask any questions that you may have, because unfortunately there seems to be a lot of misinformation. So today we are joined by two doctors, Dr. Swinburne Augustine, who is an award-winning immunologist, and Dr. Wilhelmine Adrian, who is a public health expert. So we're bringing on the experts and we're getting your questions answered. So I'm monitoring the Facebook Live and I'm checking to see if we have any questions. Now let's go ahead and continue the discussion. And this one is for you, Dr. Adrian. So how long does the protection from this particular vaccine last? Because I think one of the concerns is that we're hearing that this may be a vaccine we have to take every year. Do you have any information on how long the effectiveness of the vaccine lasts?
Actually, no, I do not have the length, but what it was recommended that they may have to repeat it on a yearly basis, just like the flu vaccine. It seems like every year we have a different strain of the flu vaccine, of the flu. And because of that, what was used in previous years might not cover you for the current year that you're in, although they try to make it as close as possible. So you hear some people say, oh, they took the flu shot and then they still have the flu, they've still got the flu in the same year, because the vaccine that they use may not have been covering the flu virus at the time, or the current period that they're taking it in. So we may have to, it's 2 doses. I know the Pfizer and Moderna they're 2 doses to get coverage, at least 95% coverage, but then we may have to repeat it next year in order to prevent another outbreak of the virus.
Right.
Or the disease, I should say.
And I have to tell you, I'm very excited because one of our other doctors who's just joined in on the Facebook Live, Dr. Tabitha Andre, is with us. Tabitha, thank you so much for being with us. And if you have any information that you would like to chime in, I know she was one of the first on the line to accept the vaccine. So I know that she believes in the science. So Dr. Andre, thank you for joining us on the live. And we also have Jerry Tewitt and Princian Julius, who just joined us as well. So come on in, guys, come on in. We're talking about the vaccine. We're taking your questions, and we are going to engage in a conversation to help us to make that so important decision. So Dr. Augustine, what about the side effects? We know about, what is it, maybe about 1 million US residents have had the vaccine already. Are there any significant side effects that we're finding out about?
No, there is this talk about Bell's palsy, where the one side of your face will droop, and like Will, I was a nurse as well. For 14 years, I was a critical care nurse and emergency room nurse, right? So we see that in hospitals, but the percentage is very small. Now, what you have to understand is that our genetics, our bodies are all different and unique. So when you give a vaccine to anyone, now the swelling, the pain that you see is actually a good sign. It means that the immune system was recruited to that site where you got the injection. They came up to that site and got the foreign substance and start to process it. It's a convoluted process, but they will make antibodies against it. Like Will said, Dr. Will said, you need the 2 shots to get coverage, because what we've seen is there's one nurse in the news that got the shot and the first shot, but within 10 days he had gotten COVID. Now you need 10 to 14 days for the first shot for it to start making the antibodies. The first antibody that will come, that will be recruited, is IgM. It's a big antibody that comes and grabs the antigen or whatever foreign particle and then takes it into the cells. The second one, and which is the one that is going to give us the immunological memory, is IgG. We have IgA, IgE, and a lot of them, but IgG is the big one. And the second dose, what it actually does is when you get the second dose 3 weeks to 4 weeks later, you have a massive immunological response with a whole bunch of antibodies that come to this to attack the foreign particle because you were already exposed to it. So then you build immunological memory. So the next time you see it, the body sees it, the immune system sees it, it just ramps up, and sometimes you won't even know that you have that symptoms. I'm pretty sure that many of us have been exposed to mumps, measles, rubella, smallpox, and stuff like that. Especially those of us in the military that used to be in the military that have been all overseas. But the military always covered us with a bunch of vaccines for the places that we're going. So that's how it helps to protect us. You need both shots for it to do that. But I think some companies, you just need one. And let me go back to what Dr. Will said a while ago about how it is that we can control the pandemic and the spread. So when you get that vaccine, you get that coverage, both shots. If you ever come in contact with it, you see the asymptomatic infections and asymptomatic spread that we're seeing. They're thinking that it may be able to help with the spread itself. So we have to see, but we'll still have to wear masks and social distance.
Yes, yes, and this is very exciting because yet another physician has just joined us. Dr. Heather Peltier is on the live with us. So I think that they as well can contribute some information if they're willing to, but it's very wonderful to see that our other medical professionals from Dominica are joining in on the live. So I think a question that often comes up is, what if you only take one dose of the vaccine? And is there an option for one of the vaccines to only have one dose? Because I mean, let's face it, how many of us will remember to go back in 3 weeks to get the second dose of the vaccine? So I think for me, that is where one of the concerns is, that we may get the first dose and forget to go back for the second dose. So two questions in general. First, if you only get the first dose, is it going to be effective at any level? And second of all, is there a vaccine available where we only need one dose?
Simon, actually, I was looking at some statistics for Pfizer, and what is said, with the first dose, you're only covered about 50%. Mm-hmm. So that means you will need the second dose to get to the 95%. Not only that, even after taking the first dose, as Dr. Augustine said, there's a period or there's a number of days before you actually start getting the immunity to that vaccine. So that's why the nurse in California would have gotten the virus, even I think just about 6 days after he got the first shot of the vaccine, he got the virus because it wasn't 12 days yet. So you only begin to get immunity 12 days after the first dose. And when you get the second one, then you'll start getting up until 95%. So that being said, I'm not sure if any of the vaccines so far allow you to have only one dose and get a 90% coverage. So we may have to continue taking 2 doses until the scientists or the manufacturers do something better that would allow us to take only 1 dose and not 2 doses. But for now, as far as I'm aware, it's 2 doses.
Mm-hmm.
Well, there are different companies producing. There are different companies producing the vaccine. So let's hope that we have only 1 shot, so people could take 1 shot and not have to remember.
Because I'm just wondering, do they give you a reminder? Do they let you set the time in your phone so
you should have
an alert? Because people are going to forget.
No, they should give you a card. Based on what I understood, they give you a card as a reminder, like when you go to your regular doctor's visit. They'll give you a card with your next appointment. So they should be giving you a card as to when you should return for your second dose.
Okay,
the
that makes sense.
Is that people might travel. The only thing is people might travel. Say if I'm here, I took my first dose, but 21 day for the Pfizer is 21 days. Moderna is 28 days. So let us suppose I travel and I'm not there to take my second dose.
Right.
I'm hoping that with my card, which would be like a passport saying that I had 1 dose, if I travel to another state, hopefully I'll be able to get that same vaccine, the second dose of it. I'm not sure how it's going to work out, but that's my only concern now, is whether somebody would go to another state and be able to get the second dose of the vaccine if they're not in their resident state.
Right, certainly. What were you going to say, Dr. Swinburne?
So Dr. Will addressed it. So there are companies who are making, and I think, I'm not quite certain yet, but I think the AstraZeneca vaccine is 1 dose. There are companies making 1 dose. And also they have, they're creating apps that when you get the vaccine, that will remind you.
That's a great idea.
They're working on some apps, because not only for it to remind you, but you can also log in if you see any adverse events, and they would be able to see it right then. You could report them right then.
So I think another question that comes to mind for a lot of people is, once you have the vaccine, you are protected, but can you still pass on the virus to other people? So do you still have to wear the mask, still have to social distance? Dr. Will, what do you think?
Yes, definitely, because actually, even during the clinical trial, the 3rd phase of the clinical trial, there were cases, not many, but there were some cases who got 2 doses, and subsequent to that, they eventually got the virus. Well, nobody died, but they got the virus. And as long as you have the virus within your system, you can pass it along to somebody. You may not develop the disease itself, but you're still capable of passing on that virus to somebody else who might not be immune, and they develop the full-blown disease. So yes, you could still pass it on if they have it.
Yeah, so I think that begs the question for a lot of people. So then why don't we just continue the social distancing and the mask wearing, since you can still pass it on to other people if you
You should continue. That's what they're saying. Not because the vaccine is here that we should not continue these things. We should actually continue social distancing, wearing your mask, washing your hands. And not only that, this morning I was listening to the news, and somebody made a comment that in order for us to have herd immunity, it would take about 10 years because of the rate that people are being immunized. I think it is going much slower than they expected. So based on the rate that they're going now, it will take 10 years. Now in 10 years, I mean, a lot can happen in 10 years. So yes, we still have to social distance.
Yeah, because
Houston, I just got a thing saying that. Go ahead.
Because Dr. Augustine, wasn't the expected amount of people immunized by the end of the year supposed to be something like, I don't know, 20 million, and we're only up to like 2 million?
Yeah. At one point it was 100 million, then 40 million, then 100 million by the end of December, then 40 million, then
It's
20, and we're still at about 2.
So what is
Now,
holding up the process?
There are lots of news reports. We can only go by news reports by those, because they are being, the companies are getting the reagents they need to produce the vaccine. And some of those, and that is where we have a problem, because the storage for a lot of those vaccines, because, and I will explain, I'm going to use this to explain, because this looks exactly like an RNA strand, right? A DNA strand.
Right.
So I will explain to it. But RNA is very, very, it's not stable. It's unstable. Quite unlike you can get a bone from thousands of years, millions of years, and still get the DNA from it. Well, RNA will degrade. It degrades very quickly, so it has to be stored in specific temperatures to keep it stable, because those vaccines are RNA vaccines. And I will explain that a little later. By the way, let me just say hi to, you mentioned 2 people that were listening in. One is Agnes Etienne. That's my aunt's, my dad's twin sister's daughter.
Oh, okay.
And Kelvin Francis, when I was supposed to match with him with the Music Lovers Band.
Okay.
Kello is from where Will is from. I think the Port Michelle area.
La Puente.
Yes, La Puente. Anyways, hi to all of you all.
Yes, and thank you for being here.
Yes, so we just have to trust the process, and you see a lot of people taking the shots online or on TV. The president-elect, the current vice president, the vice president-elect, doctors, nurses, and one of the people that was involved in creating the vaccine, well, 2 of them, as a matter of fact. One is Dr. Kizzy Corbett at the NIH. She works with Dr. Fauci. She's Black. The other person I'd like to talk about is my school, the medical school I went to, Meharry Medical College. Not last week, the president and CEO of the school, Dr. James Hildreth, he is a Black man. He has been doing HIV research and working on HIV vaccines and treatments for a long, long time. And he took his vaccine, but he is one of those people on the FDA advisory board that approves those vaccines. So we are up in the forefront trying to dispel this thing, because we are being hit harder. And if we continue the ignorance and listening to misinformation, we will lose a lot of people.
Yes.
You know, this is serious. This is not a joke. And like you said, just this month alone, we lost the entire population of Dominica.
The entire population of Dominica in 1 month.
Yes. So it's not a joke.
Serious, yeah. And you know, the questions are coming in on Facebook, so we want to thank our viewers for the questions. We have from Shari Bryant: is the risk for children the same as adults? And luckily we have Dr. Andre in our audience. So she said children were not part of the clinical trials, so vaccine is not recommended for them yet. And Dr. Andre also says, as someone who had gotten the first dose, forgetting the second dose is not an option. Yes, you are given a reminder card to remind you. Yes, so we have a nice conversation going on. So again, it's not approved for children under 16, is it?
Well, actually, Moderna is covering from 18 years and Pfizer is from 16 years. 16. So there's still an age difference. Yes, 16 and 18, an age difference.
Yes, and we have more questions coming in, but I just wanted to raise the point of the storage. because that is yet another area of concern that popped up when we hear that the vaccine has to be stored at a particular temperature. And I'm thinking to myself, well, what if I get injected with the vaccine and it wasn't at the right temperature? What happens then?
Oh, that temperature, the below minus 70, minus 80, minus 94, those are extremely cold to protect the thing. So, but you have to bring it. They can't inject it that cold into your system. They have to bring it to room temperature, right? So, because it would be frozen. So you need, but it cannot be at room temperature for too long. And it will degrade and it won't be effective. So that's the key. But I think the AstraZeneca vaccine doesn't have to be stored at that temperature. Now, AstraZeneca may not be one of those mRNA vaccines. It may just be the old way that we did vaccines, where you got the virus and you purified, you cut out pieces of it. But the immunogenic part of the virus that they make in the vaccine is that spike protein, those little spikes you see all on the surface of the virus. That's where it binds. It uses those spikes to bind to our nasal passages and in our lungs and our cells. And when it binds with the spike protein has a little binding domain that binds to our ACE angiotensin converting enzyme 2 receptors on our cells. And when it binds, it signals, it opens up and lets it in. And then it releases the RNA. So here, with the new vaccines, so each of those light colors you see, there's a bands, and each of those areas code for a different protein. So let's say this part of the strand codes for the spike, just the spike protein. We know the sequence, they know the sequence, they excise or synthesize that sequence, and then now you have just the RNA that will code for the spike protein, and it's just, they put it in, like an oily nanoparticle to preserve it. It reminds me of like something that we can see, a cod liver oil capsule. See that little cover, once it gets into your stomach, it degrades, and then the cod liver oil is released. But you need it to get in there so that it can, you need a vehicle to be able to inject it into the humans. That is why the temperatures are so different. The RNA to prevent it from degrading, but the ones that use the old ways, using pieces of the virus and then injecting it, you don't need. If it's proteins can last for a while without degrading, and the body will still make antibodies against them.
Yes, and it kind of begs the question, because there are different options for the vaccine. Do we have an option? If we went in to get the vaccine, can I say I prefer one over the other one?
It may be the location where you go. It depends on what they have available. So they're not going to give you what they do not have. Like, okay, I just got a text from the hospital concerning my mom that she's eligible for it, and I should set an appointment for her to collect it, to get it. I'm not sure what they have. And at this point, I do not care which one they have, because I'm going to make her appointment for her tonight. As soon as I get off, I'm going to make her appointment to take her for her injection next week. So again, it depends on where you go, and it depends on what they have available. I don't think you have a choice, except if you want to wait indefinitely to make sure you get what you want. But as far as I know, and based on the research I have done, the two that they use in the States, they're very effective, and I'm ready for mine.
Yes, me too. As soon as it's available, I'm ready to take it. Now, we have a question from Anthony Gordon. Do you know the contents of what exactly is in the vaccine? I'm not sure if we can answer this one. And please explain the use of RNA, or rather the DNA aspect, this particular vaccine, and why it is different from the DNA process of other vaccines. So that is quite a mouthful. I'm not sure, you guys are the medical experts, so I'm just gonna leave this right there and see what you can do with that question. But thank you, Anthony, for that question.
Okay, I can take that one. And so, like I said before, the RNA is just a set of letters stringed together, right? And DNA is also a set of nucleic acids strung together. A, C, T, U, you know, they strung together. And when the virus gets into your cells, what it does, it uses you have this virus is a single strand, one strand, and on that strand, all ribosomes will look at it and start reading and translating it, right? It's like you're translating, and one part is translating, it makes the spike protein, the other one makes another part of the virus, and it keeps going until you get all the parts you need to package itself. Once it does that, then it starts to replicate itself and then bursts out of the cell. Now imagine a number of viruses in a bunch of your cells bursting out to go infect other cells, and that cycle keeps repeating itself. Mm-hmm. That becomes dangerous. Now, we used proteins before, not DNA, with previous vaccines. They would purify it. First they would kill or chemically kill the virus or bacterium or whatever it was, and then inject that into you. But then they found out that, well, you can't be 100% that every single one of them is dead. Now here, we've taken just the little part for the spike protein, put in it, and let the ribosome do it. So it's making a whole bunch of spike proteins. That is non-infectious. Mm-hmm. It's our body is using the same mechanism that the virus was using to force it to make the spike protein and make antibodies against it. So whenever it sees that virus, it sees all the spike proteins on the virus, it will bind to them. Once it binds to the antibodies bind to the spike proteins, they cannot get into your cells. Mm-hmm. And those viruses, and some of those, we call them obligate intracellular parasites, they must get into your cells for them to cause the damage and infections. So if the antibodies will block them, then they cannot get in. And that is where, so that's the difference between using the proteins, which are more stable and you can just put in your fridge at 4 degrees, or using the mRNA, which is very unstable, and you have to store them at minus 80 and below.
Yeah, so Anthony, I hope that was a good response to your question. I think that is a wonderful explanation. Thank you, Dr. Augustine. And I think what would be helpful for us right now is Dr. Whale did a wonderful presentation, and she sent it to us, a wonderful PowerPoint presentation, to just kind of walk us through some of the information, some of the frequently asked questions. So I would like for us to go ahead and take a look at this right now. But before we do, I just want to say once again, thank you everyone who is joining us on this Facebook Live. And again, if you're joining late, my name is Simone, and today we are being joined by Dr. Swinburne Augustine and Dr. Wilhelmine Adrian, who are both doctors and experts in the field of public health and experts in the field of immunology. And they are walking us through the frequently asked questions about viruses and about vaccines, because I know that there's a lot of information circulating out there, and it has our heads spinning. So I think we should follow the science, absolutely 100% follow the science, and we should listen to the medical experts. So this is one of the reasons that we've brought on our two experts today. So I just want to go ahead and grab our presentation, and Dr. Will is going to walk us through this presentation and talk a little bit more about the vaccine. Okay, so Dr. Will?
Yeah, actually, we're just going to recap some of what was already mentioned earlier before. So I just have, if you could just scroll with me, Simon, the second slide here. These are just the statistics that I gathered at about 12 o'clock this afternoon. In terms of confirmed cases globally, we are at 82 million cases plus. And in terms of death, we are past 1.5 million deaths already. For US, seeing that most of us are in the US, it's 19,000
The US cases?
500, sorry, 19 million cases, 19 million cases confirmed, well, 19.5 million confirmed, and already 339,000 deaths. Just thinking of Dominica, as Simon mentioned earlier, when you think of Dominica having a population of about 70,000, just consider the number of times Dominica's population would be in that 339,000. I mean, it's just, it sounds ridiculous, but that is the fact. If we could move on. So how the vaccine works. The vaccine, as mentioned by Dr. Augustine, it actually imitates the natural infection that would generally occur in your body with any infection. Like for the SARS vaccine or SARS-CoV-2, the antibodies would bind, and what it's supposed to be doing is to block the spike of protein to prevent it from infecting the cells in the body. And then we have the different types of vaccine. Dr. Augustine explained perfectly well the DNA and the mRNA vaccine, how it works. And he also mentioned the traditional type, which really kills, well, the traditional type, the way it was made is making the viral vaccine to kill basically the vaccine, to kill the virus, and it is with chemicals. So the flu vaccine that is done, that is how the flu vaccine is produced, is by killing the virus itself. The newer ones are what are used with viral vectors. And again, the protein that is used to combine with the inactivated virus in order to block that spike. And then there are the two kinds. They're the most common one, which is the adenovirus, and also the one that actually uses the virus itself, like the COVID virus, to use in the vaccine to prevent further spread or to kill the virus itself if you're infected with the disease. How well do we know if how will we know if the vaccine is safe or effective? The vaccine goes through 3 stages, and through all the clinical phases of the vaccine. One of the things that is looked at carefully is the safety of the vaccine itself when it's being developed, and also the efficacy of it. So you have, in the first phase, the first clinical trial phase, you would have only a few people being given that vaccine. And they will look at the safety of it, whether the people, how they respond to it, whether any immune system, whether their immune system is actually being affected with the vaccine. And then they go to the second phase, where you'll have a larger number of people. That too, you will look at the safety of it, how the people respond to it. Typically, it would involve more than like hundreds of people. They would also look at special groups like children and people with pre-existing condition like diabetes or heart disease, maybe cancer. And then you look at the adverse events that may not have occurred in the first phase, only because of the limited number of people in that first phase. You may not see people reacting adversely, but then when you have a larger population, or a larger number of people to work with, then you might see certain things that were not seen in the first phase. And then we go to the third phase, where we have thousands of people volunteering. For the COVID vaccine third phase, we had like 30,000 to 45,000 participants, and they're placed in random groups. So one group, they'll be divided in basically two groups randomly. One group would be for those receiving the vaccine, and the second group would be for those receiving a placebo. It could be another vaccine, or it could just be plain normal saline they would be given. And they would be looking at them carefully to see if there's any differences between the groups after a period of time. Also, the randomized study would basically, the investigators might not know which participants are actually getting a vaccine and which are getting a placebo. So, which is something good about it, that nobody knows who is getting what. So they can't say that there's any bias as to one particular group is getting a vaccine and another particular group is not getting it. The participants are followed closely for each group, as I said, to see if they would be developing the disease. And fewer people who received the viral vaccine will get the disease. And that is what the objective of the study is to see whether those who receive the vaccine actually get the disease. Stage 3 trial is often a longer period. For one, the participants or the volunteers are not readily available. And as Dr. Augustine was saying earlier on, in terms of this vaccine that was speedily manufactured, for regular vaccine development, it takes a lot of time because they do not always have participants who are willing to participate in the studies. But with that one, well, it's worldwide. It's been everybody's been affected one way or the other negatively. It's worldwide, so we had more participants participating in the trials. So that is one of the reasons why we were able to speed up the process of getting the vaccine developed, because they had enough people who could have received the vaccine and they were studied over time. So they look for both the long-term and the short-term effects and safety of the vaccine. The short-term safety they would look for is like somebody developing fevers, tenderness at the site, muscle aches, which is normally experienced with most vaccines, if not all vaccines. And then now we're going to look at the long-term safety of the vaccine in terms of autoimmune, where the body is going to fight its own self. So long-term effects will still be studied over time. Some rare cases may develop, but again, maybe after a longer period of time, that might manifest itself. And then in terms of processing the vaccine, again, the timeline, in the past, it was taking a longer time. As we said, now it's accelerated. So because of the pandemic, it was actually manufactured much quicker. Some people were asking as to how long will it take before the public is vaccinated? Again, it depends on the country and what are the priority groups. I know in the United States, the priority groups, the frontline workers, at different levels. And then now they're looking at people ages 65 and above, especially, and even lower if you have comorbidities or if you have health issues and they figure that you should get the vaccine, then you'll get it. As I said, I got a text this morning for my mother to make her appointment. She's 94 years old, and I believe in it so much. I wish she could live another 94 years old. So I'm going to give it to her.
Yes,
I'm going to make sure she gets it. Yeah. And then I was looking, okay, some people may ask, what is an emergency use of authorization? Okay, so we have different organizations. So every country has a process by which they could authorize use of any drug. So every drug, even basic drug like Tylenol, that is being used, it has to go through a process before it can actually be accepted and approved for use. In terms of the vaccine, it is not federally approved. However, it is only approved for as an emergency vaccine. because of the pandemic, it is being used. You see the number of deaths that is occurring. So yes, we need something. And because of the efficacy and the safety that was established during the process of the manufacturing of the drug itself, then we have permission by the FDA, which is the Food and Drug Administration, who normally approves vaccines. So they gave permission to use it only under an emergency use authorization. So that is where we're at. So it's actually not approved, but it can be used as an emergency drug. And there's several brands of the drug, but the top 5 ones is the Pfizer, which had participants of about 43,000 people with a 95% efficacy rate. Emergency use was authorized, was it last week or week before? I think it was about a week ago. So we started actually administering that vaccine. It's for 2 shots, 21 days in between. You can only receive it if you're 16 years or over. And you start getting partial protection from the 12th day after receiving the first shot. Participants in the study, we had 49% of female, 83% were white, 9% of the study participants were Black or African American, and 28% were Hispanics. And when I look at 9%, you'd think it's a very low number, but if we look at the percentage of African Americans or Blacks in America, we actually have a low percentage. We're only at 13% of the population of America. So having 10% being part of the study, I think it's a very good number to look at. And Moderna, it's already authorized for emergency use. Again, you need 2 shots of that vaccine to get 90+% efficacy. You get it 28 days between each vaccine. You have to be 18 years and over, and approximately 15,400 individuals receive the first dose during the study. And then you have now the Novavax, which is still in the 3rd phase of the trial study. And AstraZeneca, it was just this morning, was it this morning or yesterday? It was approved in the UK. And just before I came on the news, they said it may be available in the US till April. I'm not sure why it will take so long to be approved, but that is what the last news item I heard about it said. And then you have Johnson & Johnson, which is still in the 3rd phase trial of the trial study. And that is about it. It's just to recap what was said earlier. Mm-hmm. And then I have some references. That's just some participant demographics.
Yes.
And then I have some references you could go to look for. I would encourage people to go to Johns Hopkins University and Medicine, to go to their site. They can get a lot of information there. And also to CDC. There's a lot of information. I mean, there's so much. And we should try not to just take everything somebody send and post on Facebook or in our WhatsApp chat, in our social media chats. I mean, a lot of information coming through is just so wrong. And I just sometimes just shake my head and say, where are they going with that? So we need to try to start looking for the correct information as opposed to just accepting things forwarded to us on social media.
Yes, and the information can be overwhelming as well. So I'm really happy that you made a very concise presentation to us on the information that we need to know. And of course, we're still encouraging the questions to come in. We had some very good questions come in earlier. So we're encouraging our viewers to continue asking the question. But we just wanted to get Dr. Swinburne's reaction to the presentation.
It was good. And you know what? Everything on that presentation you can find at 2 sites, the CDC sites, well, more than 2. You can get them at the CDC site. You can get them on the World Health Organization site. You can also get them in the US, each county, each state, everyone is trying to push the right information out. So yeah, that's very helpful for us to know. There were a couple of words that mean a lot that Dr. Will just mentioned, and I'll briefly explain them. One of them is randomization. We have 40,000 people who are going to be in the phase 3. As a matter of fact, the chair of the department when I started, when I was at Meharry, Dr. Shirley Russell, I know she probably, if she's listening, she just posted tonight that she was in the placebo group and only found out just recently and then was given the vaccine. So Dr. Russell is an expert. I mean, she was chair of our department, right? So she took a vaccine. Randomization. How do we randomize something? You need statistics to do that. We don't just, okay, you go this side, you go that side. No, it is statistically determined. It is mathematically determined who goes in which group. And by doing it blind, then what that does, it removes bias. Will has a doctorate in public health, so she knows that very well. She knows the epidemiology of all those things very, very well. We randomize you, and then we don't know who's in which group. We just observing, and so you see if there's symptoms this way, that way, which one's being more effective and stuff like that when you challenge them. So that's when we say randomization, we don't mean I'm going to pick, because that when I'm doing it individually, I'm probably gonna be biased, you know. So to remove all bias, we try to do that. Now, before those studies are done, we have to go through an institutional review board. Any human subject research, we also do it for animals. We have an institutional body in the community, and you have pastors in there, teachers, members, prominent members of the community, ethicists. They look at your project proposal and they see what you're going to do and how you address every single thing that may happen. You have to be detailed and specific. So it's not like we just gonna sit there and call people and say, well, you know what, would you just give me your sample and we want to inject you with this. No, there are laws and guidelines that every research institution, to prevent what happened before, there are those things that we have to do. Okay, so somebody asked what were the ingredients in that vaccine. We have the RNA molecule, which is going to code, we call it coding, which will code for the spike protein. We'll make antibodies against it. Then you have that oily particle, nanoparticle that you store inside. Then you have a preservative, like some chemicals to preserve it. But none of those things have been shown to affect humans, right? Potassium chloride, for example. I mean, we have potassium all over in our body. We can't even survive without potassium. Every time you eat a banana, you get in a dose of. Every time you do eat a ripe banana, you taking in a whole bunch of potassium. So those are the things. But we know that they are not going to harm humans.
Yeah, so thank you for that, Dr. Augustine. And I think before we end this evening, and again, thank you for your contribution to the discussion, because again, the information is so overwhelming that I think it's important to have a major source where you can find the information that you need. And of course, if anyone wants the presentation that Dr. Will did for us with her permission, I would be more than happy to email it to you. My email address is pushpast10@gmail.com. So pushpast10@gmail.com if you would like the presentation, just so you can review it and keep yourself informed and inform those who might be interested in the information. So Dr. Will, do I have your permission to pass it on to anyone who might be interested?
Sure, yes. You have my permission.
Thank you. And I think for the last few minutes, I just want us to talk about the suspicion in the minority community. Because as we know, we as minorities are the ones who are most impacted by this virus. But yet we are the most reluctant to take the vaccine. And I think we have genuine reasons. I mean, all you have to do is Google Tuskegee syphilis study, and I think you can see why we're suspicious. So I am not saying that we should not be suspicious, but how do we address this on the level of public health, on the level of medicine, so we can get past this suspicion and not be caught up in the conspiracies that they're trying to inject, what was it, some microchip into our bodies and all that stuff. So let's just have a quick conversation on that before we log off.
Okay, I can attack that. I already spoke about some of it. The Belmont, think of the word B-E-L-M-O-N-T. The Belmont Report. Google that. We all have to be trained on it.
Yep.
And the Nuremberg Report. The Nuremberg was from the Nazis doing a whole bunch of experiments on people without their consents. Now, when we are not at the table, then whatever these people decide, they just gonna do to us. But if you notice, look who's talking. We are at the table.
Mm-hmm.
We have the other person I wanted to mention earlier is who is in charge of the Pfizer vaccine production. Is from Guyana.
I heard that.
Okay, so we are the lady who, one of the co-chairs of President-elect Biden's coronavirus task force, is a medical doctor and researcher at Yale University. She's from St. Thomas in the Virgin Islands. We are at the table. So we are participating, we are seeing what's going on, we are reading, we have the knowledge to analyze the data so they can't throw fast ones at us. And that's why I think people should be confident, because we are at the table.
Yes, and this whole—
And we have a voice.
Yes,
our
and this
voice
whole—
are being heard.
Yes, this whole reluctance against the vaccine. I think we just have to think of cases like polio that are no longer with us because of the importance of these same vaccines that we are discussing right now. Dr. Will, you wanted to chime in?
Oh no, I was just saying that our voices are being heard. When he said we are at the table, we have an input. So when we are at the table, we are not just sitting and listening and just digesting everything that they say. We actually speak and say what our views are and how we feel about certain things. So we are actively at the table, Dr. Augustine, if I might add to what you said.
Yes, absolutely. Yes. So as we get ready to wind down, any final thoughts? And again, thank you so much for being here with us, Dr. Augustine and Dr. Adrian, for providing the information that we need all about the virus and public health. So any final thoughts as we get ready to wind down?
I would just encourage, especially we Black people, most of the people who died earlier on were Blacks and Latino, that I would definitely encourage my Black family, friends, to go ahead and take the vaccine, because I'm going to get mine, and my mother is 94 years old, and I'm going to make sure she gets hers as soon as it becomes available to her. So I'm going to make her appointment so she can go next. So I'd really encourage we out there to go ahead and take the vaccine. I think it has more good in it than bad. We may feel some aches, we may feel some muscle tenderness, have a fever, a headache, which is pretty much common with the vaccine for maximum. Just better than not getting the vaccine and ending up being on a body bag. So if that's what it takes. Go vaccinated.
Yes,
And that's
thank
it. Thank
you.
you.
Thank you, Dr. Augustine.
My final words is I want everyone listening and those that are not listening that you're going to tell. I want each of you to have a safe and healthy 2021. We have had, we might say that 2020 was horrible. But you know what? 2020 taught us to appreciate a lot of the things we have, not the things we want and think that we need. It has taught us. But for you to have a healthy 2021, there are three things that will get you there: a vaccine, the masks, and social distancing until everyone has gotten their 2 shots and that we have reached somewhere nearing herd immunity, which is at least 70 to 80% of the population. If 20, 30% don't take that vaccine, by us, 70% having taken it, we are still protecting them. So the nonsense about people talking about vaccines cause this and vaccines cause that, well, you know what? We are not crippled or not in healthcare morasses because they gave us a lot of vaccines when we were small. You know, so stop the foolishness. We are all educated people. I don't care. My grandfather didn't go to no high school, but I didn't know a smarter man than him. He always said, "Education sans cervelle, c'est not." Education without common sense is zero. Get your information from reliable sources because this information actually seriously deals with your life or death. That is, have a happy new year, everyone. Thank you,
Yes.
Simone, for
Yes.
programs like this where we can, because a lot of us don't have, when we write papers and we do stuff, where there's a certain community that see it around the world. But for things like this, where we can talk one-on-one with our people, I think this is invaluable. Mm-hmm. You are doing a great service to our people. And there are many of us who will volunteer our time for that because our country has given us a whole lot. This country has given us a whole lot and we want it to succeed. And so happy 2021, be safe. I hope to talk to you all again next year.
Yes, thank you, Dr. Augustine. Thank you, Dr. Will. And of course, you know, the work that I do is not possible without people like you who are willing to come on and share with us. So we certainly appreciate that you're with us. And we're also happy for everyone who tuned in today. And we had 2 other physicians on the live, Dr. Tabitha Andre, and Dr. Heather Peltier, who says, great presentation. So I feel like we had a powerhouse of medical experts with us today, just chiming in on the conversation and kind of strengthening the information that we're putting out there. So again, I want to thank everyone for being with us. Don't forget to share this information, share the live with as many people as possible so that we can continue spreading the information about the science. Not the conspiracies, not what, you know, your barber down the road or your hairstylist down the road told you and all the conspiracies we hear that are out there. We are going to follow the science and we're going to get past this pandemic because unfortunately, it is even worse than when we started all of this back in March. It might be difficult to wrap your head around it, but we are right now in a worse situation than when all of this started back in March. So again, I just want to thank everyone for being here. And if this was your first time joining us on the live, you've been watching Push Past 10 Facebook Live, and we're all about promoting companies, promoting talent, providing information, and of course, giving you lots of entertainment. So be sure to follow us because we have a wonderful lineup of entertainment, information, motivation coming up for you in 2021. I keep thinking to myself, in 2021, 2021, no matter what happens, we are claiming our lives back. So that is going to be our goal in 2021, and we're going to start afresh with Untapped Potential, my radio show. So again, if you would like more information about everything that we do, please visit pushpast10.com. So that is PUSHPAST10.com for more information, or take a look at the other Facebook Lives that we've produced so you can get a sense of what we have going on. And we have some great surprises coming up for you. As a matter of fact, you know, next Saturday we have a big entertainer joining us. I'm going to keep that as a surprise, but he will be joining us next Saturday. So for all your programming, all your information, please be sure to follow Push Past 10. And thank you everyone who has done just that. So with that, I want to say Happy New Year to everyone. Have a safe and enjoyable New Year's, but keep in mind that unfortunately we are in a worse position now than we were when the pandemic started. So I want us to keep that in mind and just think about what we can do to finally get beyond this pandemic so we can go back to enjoying Carnival, to enjoying, you know, the outdoor barbecues and liming and hanging out. All right, so again, I want to thank you, and I want to thank everyone who asked the questions and everyone who chimed in. So you have yourself a wonderful evening, and be sure to join us next week for more live presentations. Good evening, everyone.